Images like these probably come to your mind. Healthcare workers putting on full protective gear as they get ready to help people fighting COVID. And now some of those workers are sharing what it was like to live through this. So this is a new book out. It's called Just Breathe. It's a collection of journal entries and stories written by workers at Centracare St. Cloud Hospital. Behind the compilation are three nurses, Amanda Shank, Lisa Kilgard, and Nicole May. Here are some of the entries they wrote.
She had been on a ventilator for a few days and had to have her baby early. I remember how sick and fatigued she was, still needing a lot of oxygen and could not even get out of bed. She was not able to hold her baby yet, and it had been days since the baby was born.
One day my silver lining was I made it to work and home without crying in my car. Another day it was watching my patient discharged from the hospital after no one thought he would live.
I watched their transformation from strong, healthy people who came to the hospital, some with just a sore throat, to a fragile, brittle shell, incapable of even getting a breath of air. As I read their obituaries, my mind flooded with images from stories they had shared with me in their last breaths as I sat at their bedside.
Hard to hear some of those stories. So you can find the book. It's available right now on Amazon. The nurses told me that this was a way for them to heal, right? The writing and kind of sharing what they went through. But they also hope that families, especially if patients maybe who passed from COVID, are able to read it too. They said that they want these families to know they were doing their best. All of them. They were doing their best, and they wish that these families could have been by their loved one's side and, you know, not having to say goodbye through an iPad. It was really tough to hear some of the things that they wrote.
Our nurses went through so much during the pandemic, and no wonder they're all suffering from burnout right now. They're getting out of nursing and going into other things. I mean, we owe them a debt of gratitude for sure.
All the healthcare workers really went through it.
Oh yeah.
All right, time.